Hey guys, Mike here from nursing.com. And today what we're going to talk about are the categories and subcategories that you're going to see on your upcoming NCLEX. Now, the way they've broken it down, there are 4 main categories of questions, and 2 of those categories have subcategories below them. So let's get into them. First category is safe and effective care environment. That's broken down to 2 other subcategories. The first is management of care. And what that means is providing and directing nursing care that enhances the care delivery setting to protect the client and healthcare personnel. So what kind of stuff are we going to see in that category? Things like organizing your workload, advocating for clients' rights, maintaining confidentiality and privacy, verifying orders, verifying the client receives education, recognizing limitations of yourself and others, practicing within your scope of practice. So there's a lot of things under management of care. You can review them all if you go to nursing.com, or you can go to the test plan on the NCSBN website, and they'll have all this information. We're just going over some of it for you. The other subcategory is safety and infection control. Come on. We just got through COVID. We should all know about infection control. But what it says is it's protecting clients and healthcare personnel from health and environmental hazards. Seems simple enough. Promoting staff safety, assessing the environment, educating the client on safety issues, following security plans. Let's see, what else? Anything else? Oh, follow requirements when using restraints. I'm pretty sure restraints is going to come up somewhere on the NCLEX, so you might just want to review that. Timing, orders, that kind of thing. The next category, the second category, is health promotion and maintenance. Big category here, guys. The nurse provides and directs nursing care of the client that incorporates knowledge of expected growth and development principles, prevention and or early detection of health problems, and strategies to improve optimal health. And when I read that, it sounds like being a nurse, right? It's pretty simple. Under there, you have, a little bit of pediatrics here. Caring for kids from toddler to 2, from 3 to 17, from 18 to 64, and over age 65. So they break it up a little bit into the age groups. Postpartum care, prenatal care, a little bit of OB. There will be some OB on the test. Don't freak out about it. Just review your OB lectures. Know your important facts. Let's see. Resources to minimize communication barriers. We talk about interpreters, whether it's a phone or a tablet. There's always some sort of interpretation service. You cannot interpret unless you are a legally certified interpreter. Always remember that. And when you go into your career, remember that, all right? Perform comprehensive health assessments. Come on. How many times have we done that in school? All right? We had entire classes on health assessment. Health education, screening assessments. Screening assessments, when you get into your career, you're going to find out about screening assessments like suicide and falls and skin, things like that. All right, moving on. Our next category is a standalone category, Psychosocial Integrity. Nurse provides and directs the nursing care that promotes and supports the emotional, mental, and social well-being of the client experiencing stressful events, as well as clients with acute or chronic mental illness. This is a big one. It's basically our psych patients, right? Assessing client support, providing for clients experiencing grief or loss. We're going to see that a lot, especially if you're in the ER, the ICU. We do see a lot of deaths. You have to know how to deal with grief. Recognizing nonverbal cues to physical and or psychological stressors. That's a big one. I mean, that's kind of big picture critical thinking stuff. You have to know, and you have to watch your patients, especially your psych patients, and look for those nonverbal cues. Using therapeutic communication. You've all learned about that. Promoting a therapeutic environment. I'll let you guys look at the rest. All right, then we have the last category, the fourth category, and it's broken into 4 subcategories. Physiological integrity is the 4th category. And this is the nurse promotes physical health and wellness by providing care and comfort, reducing client risk potential, and managing health alterations. The first subcategory is basic care and comfort. Basic, right? Skin assessments, removing orthopedic devices, assessing for pain, assessing nutrition, providing postmortem care, assessing sleep and rest patterns. This is the basic care and comfort, and that's why it's called basic care and comfort. Moving on. Pharmacological and parenteral therapies. This is meds, all right? This is pharmacology, blood products, client responses to medication, medication education. That's a big term, but you need to know the meds, and then you need to educate your patients about what you're about to give them. Right? It's kind of important. Monitor IV sites, monitor IV infusions, administer meds for pain management. Big thing with pain management is reassessment. You can give pain meds, but you have to reassess after you give them. Did they actually work? All right. Next category, reduction. This is the subcategory, reduction of risk potential. Reducing likelihood that clients will develop complications or health problems related to existing conditions, treatments, or procedures. Basically, don't mess up your patients any more than they're messed up, right? And this goes over things like labs, blood specimens, OG tubes, catheters, peripheral IV lines, PEG tubes. It's evaluating and maintaining all of those things. Performing focused assessments, pre-op care, peri-op care, procedural sedation or moderate sedation, managing clients during that. Oh, using devices to maintain venous return, like the TED stockings or I don't know what term your hospital uses, but it's the squeezy leg compression devices. Those promote venous return. Next subcategory, physiological adaptation. Managing and providing care for clients with acute, chronic, or life-threatening physical health conditions. Okay. Let's see. Maintaining temperature, caring for clients on a vent. It's a big one. And part of that is avoiding ventilator-associated pneumonia or ventilator infections. Wound care, suctioning, pulmonary hygiene, maintaining arterial lines, pacing devices, care of a client on tele, most of our patients. Managing the care of a client in alteration with hemodynamics, tissue perfusion, or homeostasis. Well, alteration is hemodynamics is simple. Their vitals went south. How do you fix that? Performing emergency care, identifying the pathophysiology related to an acute or chronic condition. Big one. Recognizing signs and symptoms of client complications and intervene. All right, guys. There are a lot of categories. There's a lot of information. I highly recommend that you hit up nursing.com or the NCSBN website, download the test plan, hit us up for questions and more category breakdowns. You guys are all going to do great. I have no concerns about anybody who's actually watching these videos. You're showing the dedication to want to learn and want to do well, which means you will. Hey guys, so I hope this video helps you in your nursing journey. Now go out, be your best self today, and as always, happy nursing.